So welcome everybody. Thank you for joining us. This is a part of the Yorkshire and Humber ARC Lunch and Learn series. It's a bit late for lunch and a bit early for tea, but the principle is hopefully you've got a cup of tea or something so we can have a conversation. And this is around, we're really fortunate to have Professor Anne-Marie Keenan in our Yorkshire and Humber patch, who is, I'll let you introduce yourself, Anne-Marie. Go ahead.
Yeah, hi. So, I think I know a lot of you. So, lovely to see you all. I'm a professor of applied health research here at the University of Leeds, but I'm also the associate dean at the academy. Have been privileged enough to lead on some of the new investment for healthcare professionals, and what we're really keen on making sure that so this meeting is we're actually absolutely hijacking the ACORN group, and thank you so much for allowing us to do this. But it's around just profiling so people are aware what's coming up, and really importantly it's talking about from a care provider, whether it's trust, social care, what are the things that we probably need to be thinking about. So we can go through all of those, and we've got obviously a number of fabulous colleagues here who are from the university and the ARC and the BRC to try and help, because this is absolutely is only going to work if we have a partnership approach to this.
Have I started screen sharing? Can you see it?
Yes, you can. It's not quite on presentation mode yet.
Trying. There we are, hopefully.
Perfect.
But now I can't see anybody, Anne-Marie, so you're going to have to shout at me, and I'll press the button. Thanks.
Yeah, so happy to take questions as we go along, or just to leave it until the end. So if you put the hand up, I should be able to see it. But again, apologies if you've already heard this before. This is what we presented last time. But it's really around this new investment, which is based on the best research for best health, and it talks about strengthening careers for research delivery and staff in underrepresented disciplines and specialisms, and it's absolutely around embedding research within the NHS. Next slide, please. And so there's a whole lot of investment, and just wanted to go through it. I think it helps, and the NIH are updating their website. It's limited what they can do on the website because they're very pleased with its accessibility, but if you can kind of try and look at it in terms of the different career stages, I think that's useful. Just also to highlight that this, I'm not going to talk about the PCAF, DCAF, and advanced fellowships, ACAF. They're all there, they're going along, and in fact we're getting more funding for each of those. So, but these are the new schemes that you might be just trying to get your head around. So let's talk about the undergraduate and pre-registration. So the Insight competition is initially 3 years of funding, and it's absolutely designed to get health and care professionals interested in research early. We know, I'm a classic example, I didn't do my PhD till I was 42. You know, that's pretty common for our group, and while there's nothing wrong with that and we really want to support people doing that, it would be good to get them earlier. And so this is around kind of developing engagement programs, and this will be across the region. And so we've been working, it's been just delightful working across the Yorkshire and Humber region to make sure that we've got all of the pre-registration undergraduate programs and to provide them with kind of inspirational, aspirational research careers, because we know that in a really packed undergraduate program, research is not prioritised, and often the research that's presented is stats, and nobody cares about stats. You know, seriously, unless you're doing maths, you don't go and do a HCP degree to understand stats. And so, and this will be around providing role models and just signposting to different areas. And there's also MRes places, and these specifically are around providing the MRES places early for early, and this is deliberately flexible, what we're calling early, because that depends on different career stages, but typically between 2, 3 or 4 years post registration. Next slide, please. So it's 3 years of funding. They're hosted by universities, and we've had a brilliant engagement across the Yorkshire and Humber. They're supposedly going to be announced in 2024 and the funding commences in April. As I was saying, Marina was laughing. We still haven't heard, and it's still with Department of Health and Social Care, but what we do know is every region has been allocated a post, so I think we can assume that Yorkshire and Humber are going to have these posts. Is there a next slide around what this means to the NHS?
So I'm happy just to talk.
Yes,
thanks.
thanks.
Okay, Marie.
Yeah.
And most of you know me from our ACON group, but for those who don't, my name's Sam Debbage. I'm the Director of Education and Research at Doncaster and Bath Teaching Hospitals, but also the academic lead for the Yorkshire and Humber ARC. So I am really fortunate enough to have the insight into the NHS and think about how this translates. So I think most of us on this call have been involved in the Insight application, and I would just encourage us to have line of sight, and we'll be back engaging as we get the formal confirmation that we've received it, but to consider those academic partners we currently work with and the opportunities this will bring us, and also to consider it will bring additional tariff in. We look after students, they bring educational tariff, so with that think about what you might want to do with that, use this as an opportunity to build capacity in the longest sense. So take this as the first point of contact, but think about the ripple implications and wider than what it says it's going to do on the tin. Is that okay, Emily, for now?
Yeah, and what we're really looking for around the Insight program is we will be wanting role models from the NHS who are living and breathing, doing clinical research, and that could be research delivery, it could be as a PI. We're also going to be looking at having members who are going to be part of the supervisory team, and we're looking for discipline-specific mentorship. So if you've got expertise in a particular methodology, profession-specific mentorship, and we really want to make sure that one of the things that we want to offer with the Insight program is kind of a tripartite approach, so that you will do an MRES program within a university. And at the moment, the universities are Bradford, York, Sheffield, and Leeds. But then you are interacting with the wider Yorkshire community, because we know that that's where we're likely to find those disciplines. So they're the kind of things that are really important in terms of making sure this is going to work. Next slide, please. Now, this is a hilarious fund. So this was launched on the 19th of September. So this is a pre-application support fund. And this is deliberately light touch. So this is for people who don't have time and don't have any idea about how to get involved in research, in becoming involved in research. So this isn't for, and I've had this conversation with a couple of people, you have to get a pre-application support fund to write your pre-doctoral application to get a doctoral application. No, this is particularly for people who are, and we're talking about the disengaged. So if you're in a part of an NHS or part of a profession that really doesn't have much of a research knowledge, and you don't even know who to talk to, this is up to 12 months of funding, including contribution to salary, training development, and other costs as dictated, to kind of try and find out where to go and what are the things that are there. And this is kind of like the DSC Awards. So it's an ongoing call that just happens to be 3 times a year. And when you see it, it's deliberately light touch. If you're talking about underrepresented groups and people who've got no support and no help, they're not going to have a particularly impressive CV, and that's not what we're looking for. What we're looking for is just kind of a bit of a plan about what you're going to do with that time, that you're going to go and meet people at the University of York to talk about, potential courses, or to talk to someone, within another, academic, or sorry, another clinical academic, say radiographer who's been. Well, can we just make sure everyone's muted? Brilliant, thanks. Next slide, please. So this is launched and it's just being assessed. So that's, we're just seeing all of the ones that are coming in. We've also got the undergraduate internship that was launched last October and has closed, and I'm hoping that some of you have applied for this. Now this is absolutely, so it's for undergraduate internships, and it's in addition to what was the health education internships. But we know that if you have an internship, it's kind of like a research taster, and they work best when you take someone who's interested in research and you kind of piggyback them into a research group so that they can get to see what actually being involved in research is. And in terms of particularly impactful research, they kind of get to find out that research is not an isolated endeavour, that you must be a part of the team, and the internships generally evaluate very well. But this is also not just for the interns, and what we've suggested is that institutions can host up to 3 interns, because certainly it's my experience that you can have 1 intern, they take up a shed load of work, but if you have 3, they take up the same amount of work and they offer peer support, and you get a cohort effect. And so we're encouraging people to have that kind of cohort effect and cohort approach. And again, these are just, they're being launched, they're closed, and they're just being evaluated at the moment. So quite excited about those. But so they are for undergraduates, but they'll come up again in this section. So in terms of the early to mid-career opportunities, next slide, please, Sam. It's the internship, and this is around because we want a mid-career people to take on interns and take on that supervisory element, because it's a really important learning process, and it also allows them kind of the ability to supervise people without necessarily the burden and kind of the formality that goes with either a master's or a PhD. So next slide, please. We are going to expand the ICA internships. I think I'm allowed to say it publicly, but I'm going to, if I'm not, it's being recorded, so I'll get into big trouble. The Health Education England funding has finally come to the NIHR, so it will no longer be that step behind the NIHR. It's all under the one budget. So we're going to have the internship programs. What we'd like to see is, again, they'll be regionally delivered, but we would like to see much more of sharing of best practice nationally, because I think having those regional initiatives is really important. They'll be around not just research delivery, also research placement. There's also going to be bursaries for credentialing, and this is on the back of the AOMRC scheme at the moment, which offers credentialing which is a postgrad certificate and a master's for research delivery. And that's currently available to our medical colleagues, and it will now be opened up for health and care professionals. And so this is a way, because it's pretty hard to get postgraduate qualifications as an NHS research delivery person. This is absolutely around trying to enhance their career. Next slide, please. Then there's personal fellowships awards. I'm not going to talk about these. These are all there. And you can see the very attractive kind of third line down, that these are for healthcare professionals, but obviously fellowships also, we have lots of people go into the doctoral fellowship rather than the clinical doctoral fellowship. Kind of depends on where you are and what you want to do, but there's a shed load of opportunities to have funded PhD, pre-doc PhD and postdoc careers, fellowships. Next slide, please. Oh, I've got a little weird thing there. Yeah, that's us. And that's us. Sorry, I haven't seen these slides for a while, Sam. Then there's the, again, more early to mid-career opportunities. So there's more of these development skills enhancement awards. So you hopefully know that, so these are, if you'd like, postdoc bridging with purpose. That's kind of the shorthand for them. So they're not just a bridging for you to write up papers or whatever, they're bridging for you to develop your skills. So the kind of things that people often get awarded for are clinical, if you need to, for the next part of your career pathway, you need to kind of get skills in either health economics, clinical trials, big data. This is what this is for. And they were previously only opened up to Academy members, so you kind of had to have an Academy Award to get that. Sorry, an Academy Award, I don't think they ever used that term. You had to have an Oscar to actually be on this pathway. You don't anymore. So as long as you've got a PhD and you're very, you're close to a PhD, you can apply for this award. Really, really exciting. We've had a huge increase in the number of these, and because we've opened it up, we've also had an increase in uptake. So we're really excited about that. We've also got, the in-practice fellowships, and these are really important. I don't know whether Christine Comer's on the call. No. So these are for community health and primary care. So pre-doctoral and doctoral fellowships that are for particularly those who are in such as community pharmacists and healthcare visitors. So these are targeted very much. They're like the other awards, but they're slightly different because of the different requirements of primary care. And they're based on kind of a program that already exists, but they're increased in those, and so we need to kind of get those the idea to people out there that these are now being supported. Next slide, please. And then finally, there's the advanced career. So this Michelle Bridges, who some of you will know, call these the Senior CPR Awards, and I think that's a really good kind of, because of the ridiculous name, the New Generation Senior Clinical and Practitioner Awards. And these are for people who have a research qualification and have been lost to research, if you'd like. And so these are particularly for healthcare and care professionals, and 60% of the awards in the first round will go to healthcare professionals, but it's also open to medics and dentists, and particularly from underrepresented groups. So in terms of underrepresented groups for medics, they're talking about ethnicity, gender and geography. Next slide, please. And they're really generous. They provide up to half the time salary for up to 5 years. There's a huge training and development budget, and that some of that can be used for consumables if you need to collect some data, but we don't want people doing projects. And if there also might be relevant for people who are within universities and have got a PhD but are teaching, and they've lost that research activity. The start date is between the 1st of April and the 30th of September, which is interesting because our committee, the applications have just closed. We've had 111 applications. So thankfully, be able to breathe at night, because I was really worried we wouldn't have that many. I think there's 109 of them that meet the criteria. Still don't know about the quality of them, but we think that these are a real game changer in terms of trying to embed research within the NHS. So our committee meets, I think, in 2 weeks' time, and we'll turn around those fairly quickly. But again, we've had a lot of HCPs apply for this, so we're so excited. Denise, how many went in from Leeds? Was it?
Sorry, we have 9 in total, 5 HCPs and 4 medics.
Brilliant. And I know Newcastle had 10, and I'm hoping you're around the table, there are more people who have put them in. But I think the really important thing is embedding this so that this will happen the same time next year, because this was a really short turnaround time, and trying to get quality applications, particularly from underrepresented groups, was always going to be a challenge. So I think in terms of underrepresentation, I'm not sure that we'll have hit the mark as much as what we'd hope in this first round, but as this embeds, I'm hoping that we'll see a lot more of the underrepresented groups. Next slide, please. And this is just about the difference of the awards. The SCAPRA awards is really just to buy your time out with a little bit of training. The CARP, which is the MRC award, which is another postdoc award, which is similar, except it is much, much more around doing a project. And then the advanced fellowships are the all singing, all dancing, you get everything paid for there, and there where you need a strategic program of work. It has all your project costs, training, development costs, and your salary. And next slide, please. And that you can see the big thing around the SCAPRA awards is they're new. They're trying to get people who we've lost to research back into research. Whereas the CARPA is more around driving a program, and the advanced fellowship is for your all singing, all dancing, gold trim fellowship. Next slide, please. This is what's involved. So it's not just around being a PI, it's also around innovation in delivery of research. But it's not around delivering research, because that's what the RDN CRN does. And it could be all of these different activities. So it's very wide in what you can do. Next slide, please. What's not eligible is just time to do research. It needs to be a little bit more strategic, or as I said, deliver research if it's already funded within the RDN CRN. Anything that's kind of within your current roles, or any activities outside NIHR remit. Next slide, please. So, these are the first time that we've done this. We've already learnt a lot around these, and the guidance will be slightly different. It's fair to say that we've seen a huge range of different topics go in, and I think that's really important. And as I said, we're really hoping this will be a kickstart. So I guess in terms of we're making the NHS work, I can hand over to Sam about that.
Thanks, Anne-Marie. So I've just highlighted here, and I thought the reference to our long-term workforce plan was really helpful, but it's everything we already do, I think, and this just gives us a expanded opportunity and route to have those conversations with our executives and our directors, because releasing workforce is always going to be our challenge in this group of people at all these different levels. So it's about demonstrating the value of investing in our people for the long term, for the benefits of our patients, for the benefit of keeping our people and career pathways, and having that really clear research pathway for health and care professionals. So I just thought this was a helpful reference, and to really encourage you to reach out to each other to seek support, because it's not an easy path that's well trodden, but actually we have got organisations who are doing a lot of this, and we can work together to help influence the exec level from board to ward, really, and all the way through. And it's often the middle managers, the matron level, the group we need to engage with. So this gives us those different opportunities. Thanks, Anne-Marie.
Yeah, absolutely. And the other thing is, again, this organisational strategy. So it might be easy if you have, and I'm kind of living in la-la land here a bit, but say you had two occupational therapists with PhDs, and both of them wanted to do one of the SCAPRA awards. It might be a benefit to get both of them to do the awards at the same time, so then you can buy in a full-time replacement. The other thing that I think is really important, that hopefully if you're postdoc, I'm hoping that you'd be a little bit more nuanced than pre-docs, but if you're going to approach your manager about doing one of these awards, it's your responsibility to come up with some solutions about how they're going to backfill you. You know your job better than anyone, and it might it, you know, often isn't replacing like for like, particularly given the nature of some of the postdocs. You know, our healthcare professionals with postdocs are usually quite senior people. And I think it's also really important that the managers can have a say in kind of the things that would work for them. So I think that's quite useful. Next slide, please. There's the Clinical Leadership Program for AHPs, and this is to be announced very shortly. I've just seen it's just being signed off. And this is absolutely, we've just stolen from the 70 at 70 or 75 at 75 research program for nurses, using that infrastructure and developed it for AHPs. And apologise for healthcare scientists and pharmacists who don't have access to this, but eventually hoping that may work. But that's just about to be announced. And again, it's a great way for developing our clinical leaders. That's not just around kind of research, being a research PI, but it's around embedding research within the NHS. And then finally, the leadership infrastructure. So where hopefully you've seen, hopefully some of you have applied for the Associate Director of AHPs to work along the amazing Ruth Endicott, who's the Director for Nursing and Midwifery and has AHP under her remit. And that's just being, I know it was being shortlisted, and I think the interviews are being planned as we speak, but we're pretty excited about this role as a new role. And then the regional research leadership officers. So these are absolutely around having a local signposting network, because there are so many things available and because it's confusing and because things are going on in York that's different to things going on in Sheffield. And by the way, do you know about the ARC offering, you know, these things? So it's kind of around getting more of a regional flavour and joining up of the activities. Now, so we're really committed to that. Can I just say these were supposed to be part of the RDN? That's now under hot off the press. That's now being reviewed, and we're having to go back for it. So they want to fund something, but what it will look like, it won't necessarily be part of the RDN. Poor old Ruth has worked his socks off to try and get this embedded, and it hasn't worked. So there will be something, but what it looks like, we need to kind of watch this space. But there will be some regional research leadership officers. And just wanted to acknowledge this amazing team. You know, been so lucky we've had the right people at the right time, and at the NIHR Academy, NHS England, the RDN CRN. So it's been a real joint working group, and it's been so much fun to work with. It's been quick, amazing ride, but you know, we've got an amazing group of leaders here. I think that's it. Yeah, communication strategy is being developed. The NIHR web pages are being updated, and CAPA also have kind of updates on this as well. That's part of it. They've been funded by NHSE to kind of update this for CAPA. I think that's it. Any questions, comments?
I've stopped sharing, haven't I?
Yes, you have.
Good. Okay, just checking. Thank you. I don't see it. That was a lot, Anne-Marie. Thank you so much. And how things have moved on, and so people, hopefully this is a recap, and people have seen a lot of this. So I can't see any hands up, but I don't know if there's anything in the chat. Let's just check the chat. Oh, Angela, you popped your hand up.
Hi, good afternoon. So exciting, Anne-Marie, to hear all about that, and it's good to see you again. I just had a question. And I think, so I'm a pharmacist, as you know, and I think midway through the doctoral fellowship at the moment, and it's so great to see and hear that there's so much opportunity coming for people coming through now. I think the sort of challenges that I'm facing at the moment, and I don't know, you've touched on it between yourself and Sam in and around, I suppose, career and the infrastructure sort of beyond, and, you know, as you start to work your way through this trajectory. And I just wondered if there was, I suppose, resource or support in terms of helping people like myself with that. And this is about, I suppose, trying to carry on being a clinician and doing research. And then there's something about the job role and the development so that you're not still sat as an 8A that you were before the PhD. So there's quite a lot of, so the real things that I'm doing, and speaking to various different people, but it was just whether there was some signposting or support or advice that you could offer.
Yeah, I think the most important advice I have is that you should and have joint supervision. We're a bit mean about it here at Leeds, that if you're a clinical academic, you need to, at the University of Leeds and Leeds Teaching Hospital, you have to have joint job planning and joint appraisals. And the reason behind this, and it's a pain in the bum initially, it's just to set it up. Your line manager in the NHS won't want to come, and we're really wanting to force that issue, because if you do that, you then have your clinical, even if your clinical work is separate from your research work, at least the other part of your work can understand the kind of things that you're having to go through, and the kind of tensions that you've got on both sides. And then as you go along, in your third and fourth year, then you start saying, well, how do I go back? What happens when I return? And the really important thing about doing this is that then your line manager in the NHS can see the skills that you've developed, so you don't go back into that same manager role. And we've had a terrible example of someone who's been at Band 6 went back after their PhD, and it happens. The other thing is, I think we have to be grown up about this, that the NHS is not going to just give you a job as a researcher, and that for all posts, and it's an absolute fact that the NHS don't employ people, or don't have employ people, they employ posts. So if you've had to, for every post, it's got to have a business case and a rationale. And so therefore, it's really, I think, part of what your development should be about when you go back into, in an ideal world, when you go back into your NHS, it's what you're going back into. And you'd hope that you'd be going back into something that makes better use of your skills. And I think this is where the joint planning happens, that they can see that, that you have these skills that, might fit into quality assurance and so things like that. The bottom line is, though, that research has to be funded within the NHS, and it has to be funded within the university too, but it absolutely has to be funded within the NHS. And so it would be then about potentially buying you out through some bridging funding or to try and get you onto that next level, so that you can develop it. A really important part of the regional research offices, what we hoped they would be a repository for job descriptions. And I was at a meeting the other day when we were talking, it was a UCEA meeting, and probably Marina and I don't know anyone else will know what UCEA is, but it's the university and colleges kind of employment arm, and it was completely around clinical academics. And it was kind of one of those things where they say, why don't you just come up with a gender for change jobs for these clinical academics? And it's kind of like, well, no, that won't work, because you might be like, at the moment, Angela, you're 8A, so you're quite established, and then what your clinical academic job would look like would be completely different to, say, what Denise's would look like. And so what we need to do, and what we're currently doing, is working with UCEA and with NHS employers, is to come up with principles around Agenda for Change approved job descriptions. But absolutely at the base of this is that they have to have a business case for them, as you would perhaps for clinical activities. So in terms of my suggestions would be absolutely, Angela, to get right now a joint meeting with your line manager with your supervisory team. I think that's really critical to make it work.
That's really helpful, thank you. I mean, I'm trying to even take the conversation slightly wider than that professionally, because even across the pharmacy profession, there's just not really much for clinical academics. So, but I'll definitely start there. So thank you for that. And yeah, I'll keep banging the drum.
Yeah. I think at Leeds, you're kind of pushing against an open door, as long as you've got funding.
Yeah. Okay, thanks.
Marina.
Sorry, I'm just, many of you might or might not be aware of the work that the Council of Deans have done around this. And what I will do is I'll just put a couple of links in the chat. I'm not directly involved with the group that's leading, so I don't know how active they are, but it would be quite good, Anne-Marie, I think, if we bring it together with the group that you're involved with that's looking at the agenda for change, because it's very much, anyway, I'll put some links in, but what I'm trying to say is many organizations are looking at this elephant from different sides of it, but also we've moved on. I know, Angela, you're talking about a personal issue, but you did say you wanted to bring the professions and bring it broader. And we are now looking at it at the association of the institutions level. So I think it's really important that we just coordinate it and sort of nail the framework. Anyway, I'll shut up and put stuff in the chat.
And Marina, you've just said also, and then I've just gone to the chat, is there an NIH calendar? There isn't, and there should be, and that's something that we can take away to do. Because you do need to know, so when the calls are coming up. Won't help for the really crazy, oh, here's a great idea and here's some funding, where you just have to be ready for, but for the other ones we should have that. Okay, so Marina's just putting the Council of Deans information up, which is really, really helpful. Any other questions, comments? Zoe.
Hello, yes, I was just curious because there's lots of discussion around medics and allied health professionals. I'm just wondering for psychologists where we fit, because obviously we don't have a PhD, but there's doctoral level training, but we don't fit into those other categories aforementioned.
So pretty straightforward. If you're a registered psychologist or practitioner psychologist, you fit into the HCP schemes. If you've done a professional doctorate, it needs to be an equivalent. Because there's a huge difference to see between different professional doctorates. So some are very research based and some aren't. So it's trying to make sure that it's research, it's equivalent. So if you can demonstrate equivalence, then that's seen as a equivalent PhD. If you're neither of those, then you're eligible for the All Professions Scheme. So to get an All Profession doctoral fellowship, and you would be eligible for internships, etc., that aren't specifically tagged towards the clinical, the registered and regulated clinical professions. Does that help?
Yeah, that's really helpful. Thank you, because we just don't tend to fit in most of those categories.
One of the groups that we're looking at the moment, because it's not really within the academy remit, but it's absolutely within the research delivery remit, is the group of psychologists that are absolutely critical to delivery of research that aren't registered. And they're also, so there's a group of people who aren't registered, regulated healthcare professionals. And these are also, there's also the new clinical practitioners that are within the NHS. So they're people who are doing research delivery but may not be a nurse or a healthcare professional. So they're not registered, but they're a recognised group. And we've got a meeting in a couple of weeks' time with the Research Delivery Network, which was a clinical research network, to see what kind of training opportunities should be, or progression opportunities should be offered for them. Because I think that's really important, because at the moment, they're a group that are just slipping between the kind of the gaps, and so we're really keen on hearing about professions like that so that we can actually support them. Beth, you had your hand up a while back. Was that?
Yeah, I was actually just going to ask about clinical academic roles for non-medics. So I think we've covered that off, haven't we? The fact that so that's why I put my hand down afterwards, because it was on the basis of Angela's question and about how I think that is the structure that really people like Angela that I work with are aiming for. That's what they're aspiring to, but they can't see those opportunities or any role models really, for them fulfilling those roles. So I think that's what people would like to look forward to.
Yeah, so there are definitely, we have a number of these in the region.
Yeah.
And we should be profiling them.
Yeah.
I think, but these guidelines will help. So these guidelines are based around the Follett principles, which are all around the medics, and this is around joint working to get away from the terrible situation where, you know, if you've got a contract with the NHS and a contract with the university and they don't talk to one another. And this is really about the Alder Hey, the awful things that went on at Alder Hey Hospital. And so the principles are fantastic because they're saying there should be, no matter who the employer is, where possible there should be one contract and an honorary contract or whatever contract with the other person. And whether or not there's recharge for clinical activity or academic activity. There needs to be joint planning and joint appraisals. And with a lot of our medical colleagues, that's not happening, but it's what should happen. And I think we're just getting the principles for those for allied health, well, for nurses, midwives, allied health professionals, pharmacists, healthcare scientists, etc. Then there's the roles that happen, and that's where we need some flexibility and guidance. Hopefully you all know that the NIHR have changed the requirements. That it used to be that the host had to be your employer, which creates a lot of tension, particularly for PhD students, because it either meant that the university who's responsible for delivering a PhD got no funding, and in fact ended up costing the universities because you know, you don't even get the full PhD stipend, or the person had to move to the university, which again causes all sorts of problems. So they've removed that so that you can still stay within your trust and have your all your benefits, a pension, etc. And like at the University of Leeds, because we've got a great HR department, we've been able to transfer people to and from seamlessly, but it's a lot of work. But this way you can stay within the NHS. It's still not perfect because you know, you still have to have the honorary contracts, etc., but it's a big game changer. And the other thing they've done, and I'll put it in the chat, is come up with points to consider. So when you're talking, and I'm sure Angela would have loved this a couple of years ago, is like, you know, if you are looking at changing employers, what are the things you have to consider? And part of this is just stuff that we've learned. So we had someone who wanted to come to the university, and we had an agreement they'd come to the university and bring their pension, all of that. But when it came to it, they had salary sacrifice for nursery that we couldn't honour because we don't have that here in the university. And it was like, so we had to recost their grant back to the trust, which was again a lot of work. And you know, so we've got a points to consider document, and I'll put the link to that in the trust. So it's a great thing to highlight. You know, when you're having these conversations with people, these are the things that, have a talk to people that have been through it. You know, these are the things that you need to have a think about.
Thanks.
I was just going to add, we've got the SORT, the national tool coming out. We're just waiting for it to come out of embargo, but that's the self-assessment of organisational readiness for research tool. So it's predominantly for nurses, but I think it will be really applicable, and I'll be using it across all professional groups, Angela. So I think that will be really helpful. It will be a self-assessment that we'll do at a strategic level to see how ready we are to support careers, opportunities, roles in research. So that will hold a mirror up to boards and help that conversation at a different level. So it's just that's might be helpful in your conversation and your thinking as well. But we'll be sharing that through our ACORN group as well, and having discussions about how we can best utilise that to help us share and showcase where we've got challenges and where we can learn from each other. Thanks, Anne-Marie.
Brilliant. Anne, hi Anne, how you doing?
Sorry, keeping my camera off because we've got bandwidth issues here as a result of all the high winds we've had recently. So yeah, I just wanted to flag. I was invited to a meeting this morning, Yorkshire Humber CRN, and they are having we've set up a group that is going to be looking at capacity and capability building for research. I don't think they're particularly focusing on the research delivery workforce. They were kind of, I don't think they thought that far around, they've got workforce. They didn't quite know who they meant. So we had a lot of debate today about who you're talking about. But I did kind of flag to them that they just needed to make sure that whatever they're doing isn't going to trip over stuff that's already going on, and flagged up insight to them particularly. So I don't think whether you're in conversation with Neil and Gail, and who's the other one? I want to say Jamie. I'm rubbish with names, Jamie, but it began with a J anyway. Just to, just that kind of dovetailing. But obviously I can act as a bit of a conduit because I'm sitting on both. I'm sitting with a foot in both.
Do you want to
meetings?
And do you want to just make sure? So Alistair Hall and is it Megan who's the manager of Alistair? Hi. So Alistair's one of the applicants on the Inspire, and I guess it's just we just need to make sure that we're all joined together and we're not we're not working against one another. So it'd be really good to join that up. Oh, Alistair, I think you're on mute.
Right. Just to beg your pardon, I thought we had other representation on this group to ensure that happened, because I'm not going to be adequate for that link. And, Jamie and Gail and those are involved, obviously, internal to so if they're not invited, maybe they should be invited in my place, or I should get them to deputise or something.
Yeah, I think
that'd be okay.
That'd be brilliant. Sam, this is the ACORN group.
Yeah, so from an ACORN perspective, I do link with Gail and Amber and Neil. So I think we are aware of it and we're having those conversations. So I do think it is joined up, but I will triple check because Gail's coming out to my host organisation as well. But yeah, we have linked. Thank you. Thanks, Alistair.
Brilliant. And are you officially now the RDN? Not yet.
No, that's October 2024. Yeah, this year.
Oh, right. Brilliant. Okay, so I can still keep saying CRN. Good. Brilliant. Any other comments, questions, queries?
Can't see any more hands up, Anne-Marie. So thank you so much. That's been really helpful. We'll share the slides. I'll make sure everyone who's registered, I'll get Nicola to share the slide deck with us. And I think you'll all know Anne-Marie's contact and mine if you want to come and ask us any questions afterwards, and we'll pick it up again to our ACORN. If you're not an ACORN member, also get in touch. If your organisations, a lot of the organisations on here are, and if you don't know who your person is, we can signpost as well. So just a bit of a flag for that, because that's about connecting people and developing community. Thank you all for your time. Really nice to see you all, and thanks very much, Anne-Marie. Really helpful. Thank you.
Brilliant. Okay, thanks everyone.
Bye bye.